Hello, it's Dr. Rhonda Johnson. Today is Thursday, September 28th, 2023, and today I'm talking about stress. So what is stress? Now, the first thing I want to say is I'm talking about adult stress. Children may manifest stress a little bit differently. While the World Health Organization defines stress as a state of worry or mental tension caused by a difficult situation. Now, stress is usually described as feelings of being overwhelmed or even being under pressure. Now, it is a natural human response that prompts us to address the challenges and threats in our lives. And everybody experiences stress to some degree because it is a normal reaction to the pressures of everyday life. And stress isn't always bad for you. In an emergency, stress can give you the additional strength to defend yourself. Now, the stress response activates the release of stress hormones such as cortisol and adrenaline. Now, elevated cortisol levels can cause all kinds of potential health problems, including decreased bone density, weight gain, high blood pressure, elevated cholesterol levels, changes in your immune function, and even changes in your brain structure and your brain function. Now, stress can be harmful when it affects our well-being and our ability to carry out our functions in a negative way. So take the time to listen to your body. Is it sending you some of these stress signals? Now, not all of these. You may not have all of them. You may have some, or you may have none. But you can have heart palpitations, chest pain. You can frequently clench your jaw or grind your teeth, especially at night. Frequent colds or infections, depression or anxiety, fatigue. Changes in your eating habits with weight gain or weight loss, sleeping more or less than usual for you, headaches, migraines, chronic back, shoulder, and neck pain, gastrointestinal disturbances such as diarrhea, constipation, or pain. You can have sexual difficulties and changes in your sex drive. You can have difficulty concentrating, remembering, and sleep disruptions. And social withdrawal and isolation. So experts say learning how to manage stress is an important skill. And Medical News Today had an online article. It's a little old, from October 30th, 2020, but I think it's still good advice. They quote the American Institute of Stress, who suggests some of the following techniques to help reduce stress in a healthy way. These include meditation, relaxation, massages and acupuncture sessions, knitting and other crafts or hobbies, exercise or physical activity, volunteering, keeping a journal, aromatherapy, medications may be needed. You'd have to see a doctor for that. People will find that there are certain strategies that work for them more than others. Now, prevention. The best way to prevent stress is to find out which circumstances are stressful and, if possible, avoid it. But it's not always possible to avoid your stressors. So you may need these techniques to help you manage. You may also want to see a doctor if your symptoms of stress affect your ability to participate in daily activities. Now, prognosis. Most people will get stress at different points in your life. And if you learn how to manage your stress, you're more likely to be successful. Now, if you need prescription medication from the doctor, then use it. So in summary, stress is a condition that most of us get at some point in our life. Try to reduce your stress by using stress management techniques. See a doctor if you need to explore other options. And always remember, folks, the 988 Suicide and Crisis Line. In the United States, available 24/7 and 365 days a year to help. There are trained counselors available for you. That's my message. As always, take care, folks, and be well. And I forgot pets. Some people use pets. Now, I don't have any pets, but I have my pet plants. Take care.